So clinical manifestations of hypertension. If it's very severe, you might have symptoms that are going to affect other systems of your body. Reduce activity tolerance, fatigue, dizziness, because it's going to affect your brain. If you already have coronary artery disease, then it could cause angina or chest pain. If you've already got bad valves and you have really high pressure, then blood pressure, then the blood will not circulate and you can have shortness of breath. Really high pressures can sometimes cause nosebleeds, epistaxis, or headaches. Epitaxis, that's not the word I want. I can't remember. Epitaxis, yeah, whatever it is. Okay, complications. High blood pressure will increase coronary artery disease. Long term will cause coronary artery disease because it will build up plaque due to high pressures. Left ventricular hypertrophy. Your left ventricle will hypertrophy over a long period of time due to high pressures in your peripheral arteries, and your heart has to beat against those high pressures. Heart failure, really hand in hand with left ventricular hypertrophy. Heart failure over a long period of time will be caused by high blood pressure because your heart cannot work forever beating and working against high pressures. Cerebrovascular disease. High pressures will cause a stroke in the brain. That has a high risk to that. Peripheral vascular disease, that is another aspect that's going to be affected due to high pressures. It'll eliminate the elasticity. It'll also cause damage to the internal layer of your vascular system. If you're diabetic, that'll just add other components to it. Nephrosclerosis, high blood pressure will cause your kidney to not function as well. Over a long period of time, you will go into renal insufficiency. You'll see more protein in your urine, which basically is saying that we can't, the kidney's not doing the best job. And then retinal damage. Over a long period of time, tiny little arterioles in your eye will be damaged and you'll have retinal damage and vision problems. So we looked at the other complications. Genetic risk factors. You cannot modify these factors. You cannot modify family history. You cannot modify gender, age, or ethnicity. These are set in stone. Can't do anything about those. But we can modify other things. We can modify your alcohol intake, tobacco, caffeine, your sedentary lifestyle. Do you exercise? Are you obese? We can modify high salt and fat intake to help reduce reduce your triglycerides and cholesterol. Oral contraceptives or estrogen. That's another thing we can modify. Those have an effect on blood pressure and your arteries and vascular system. Stress. We can reduce our stress. Get a new job, change, whatever you need. You can reduce your stress. So other physical problems that's going to come about because of high blood pressure we just mentioned. You got renal failure. Respiratory, COPD. If you have COPD, that's going to affect your blood pressure, how your heart operates. Cardiac problems. If you've already got valvular problems, then that's going to affect your blood pressure. If you do not have valve problems, over a long period of time of high pressures in your arterial system, especially your aorta on down, will cause and attribute to valvular problems. So, when we assess high blood pressure, well, a lot of people have high blood pressure, but they don't have these extreme issues. They may not have headache or vision changes, edema or nosebleeds. Those sometimes are very extreme high blood pressure. Stress levels, sure, you can actually assess that, but someone's going to say, are you under stress? And they may say, no, I'm not under stress. But how are we quantifying stress? They've had it so long, they may think it's normal. You may think it's high stress. Also, type A personalities. Some people with type A personalities have high blood pressure, and they also have increase of cardiac disease because of long time high stress and the endorphins, not the endorphins, sorry, the norepinephrine that's excreted. So treatment for hypertension, you have to modify the risk factors. Modify the risk factors so you don't have complications down the road. And usually medication compliance. If high blood pressure is a silent killer, then if you don't have any medications or you don't have any insurance and it costs extra money to get this medication, or you don't think you need it because you don't have symptoms, then why would someone continue the medication? So compliance is important. Even though you feel fine, you need to continue the medications. This is hard for some people to realize. So hypertensive crisis, these are patients that have diastolic blood pressure above 140. They are not compliant with their medications. They might never have been on medications. You can also see hypertensive crisis with cocaine or crack use. These are the people that they end up in the hospital because they have a nosebleed, they have headaches, nausea, they have something that's happening, and they go to the ER because they had a seizure, nausea, whatever the problem is, nosebleeds. Let's take a blood pressure, and my gosh, their blood pressure is 280 over 150. These patients usually at this point are so at risk, they're afraid for them to have more complications. They will try to bring down the blood pressure through IV medications. So let's slowly bring down that blood pressure is what we need to do.